Hello, everyone. Welcome to our webinar hosted by the American Public Human Services Association, also known as APHSA, in partnership with Northwoods. Today's webinar topic is A Home for Every Child, aligning policy, practice, and data. We can go to the next slide, please. So my name is Francesca Robinson. I'm an instructional designer with APHSA, and I'd love to just take a few moments to share a little bit about who we are and the work we're proud to do alongside of our members. So at APHSA, we represent human services agencies at the state, county, and city levels from across the country. We're a bipartisan organization dedicated to building common ground and generating practical solutions that work for people and communities. Next slide, please. So we aim to advance the well-being of individuals, families, and communities through three core channels. So that would be influencing modern approaches to sound policy, building the capacity of public agencies, and connecting leaders to accelerate learning and generate practical solutions. So our vision is one of thriving communities built on human potential. Next slide, please. And speaking of staying connected, I just want to share that our 2026 conferences are in Arlington, Virginia, New Orleans, Louisiana, Spokane, Washington, and Salt Lake City, Utah. And you can find more about these conferences on the events page at aphsa.org throughout the year to learn about the conferences in general, including registration dates, keynote speakers, and different sessions. And the next slide. And then lastly, APHSA also offers a career center, which is a dedicated job board and talent marketplace designed specifically to connect professionals with career opportunities across the human services sector. So it's really a valuable resource for individuals seeking new roles, advancing their careers, or just exploring what's out there in the sector. So lastly, before I turn it over to our presenters, just a couple of housekeeping items. So this webinar is being recorded and it'll be circulated shortly after the event to anyone who registered. And during this webinar, you may have noticed that the chat feature is disabled. We're also asking that you put all of your questions for our presenters in the Q&A panel. The panelists will try to answer questions, as many as possible, live, and they'll also have time at the end to answer additional questions. So with all of that said, it's my pleasure to introduce our moderator for today, Amy Drapcho.
Thank you so much, Francesca, and thank you to APHSA for partnering with Northwoods to host this webinar. I also want to thank everyone who's tuned in today to spend the hour with us. Child welfare policy across the country is at a very pivotal moment. It's gaining a lot of momentum. The Home for Every Child initiative has 10 states signed on as I'm following along. I think Iowa announced earlier this week, and now Alabama just announced as the 10th state. So I want to thank our panelists for joining us today to impart some wisdom and share some insights with us. And I'm going to turn it over to the panelists shortly. Next slide, please. I'd like to introduce Mike Leach from Think of Us. And then we did have a change in one of our panelists. Anna Beltran from Kinship and Grandfamilies Support Network could not be here at the last minute. And so we have Kristen Kiefer from Generations United joining us. And Kristen, we really appreciate having you join in with short notice. We also have Rita Sorinen from the Dave Thomas Foundation for Adoption and Mark Ruff from Northwoods. So at this time, I'm going to turn it over to each panelist and ask them to tell a little bit more about their background, their organization, and just a general reaction to A Home for Every Child and the policy shift that it represents. So Mike, we'll start with you.
Hey everyone, thanks for joining. This is really exciting and happy to be here. My name is Michael Leach. I serve as the Chief External Engagement Officer at Think of Us. I'm an executive in residence. And I previously led the South Carolina Department of Social Services. So I was the state director for the last 6 years. And prior to that, have worked in Tennessee as deputy commissioner and many other positions as well. Again, over the course of my career, I've led large-scale system transformations, making sure we're reducing the number of children in foster care, expanding kinship placements, decreasing turnover to less than 10% for our workforce, and then improving timely permanency outcomes. And outcomes don't change because of policy alone, right? And so I think this is a really good conversation. They change based on how decisions are made every day, and I think we need to talk about that. I work for Think of Us, and we're a national organization working to transform child welfare into a child and family well-being system, and one that prevents unnecessary separation, strengthens families, and ensures young people have connection and opportunity. And we do that by bringing together lived experience, policy, and technology, and hopefully translating that into practical real-world change. So glad to be here, and thank you for that. Um, do you want me to go into? Yeah. So my opening reaction to a home for every child really is that when when we ask policymakers, well, let me start here. Um, I think it's a shift that represents it's the right direction, right? So the real question, I guess, is whether we can translate this direction into what families actually experience, right? How on the ground can we make sure that we're executing this? Making sure that we have that shift towards prevention. I love a home for everybody thinks it's more foster families, but it's prevention, it's kinship, it's faster permanency and better alignment across systems. So, you know, that's great. How do we execute that on the ground? How do we make sure our workforce is supported and are doing things that are impactful and not all the other things that they have to do in their job that isn't impactful, right? So I think that's my initial opening reaction.
Thank you so much, Mike, and well said. And you do raise some good issues. So thank you. Kristen, I'll pass it on to you to tell us a little bit more about yourself, your organization, and your general reaction.
Yeah, sure. Thank you, Amy, and thank you for having us here at the table today. My name is Kristen Kiefer. I currently serve as the Executive Director of Generations United. But by way of background, I've been in the national nonprofit space most of my career, in different capacities, really championing particularly issues in the aging services space, but I've also led a community-based organization right here in my backyard because I believe in the power of the boots on the ground to inform national policy and advocacy. So I maintain that every voice has a seat at the table in the moments when they matter most. So this work is really critical. Generations United works across generations from children to youth and older adults with the goal of strengthening families. We do have a keen interest and focus on grandfamilies and kinship care in our work. And what really keeps me in this work, or even got me into expanding the horizons of the work that I've done over my career, is really seeing the everyday ways that families and non-families step up for children. They step up and in long before systems do. And when you recognize that those connections and support them, we don't just improve outcomes like Mike is talking about. We prevent disruption and ideally build stability that lasts. And I think that is the goal. And so kind of segueing into and kind of building off what Mike already said about the reactions to the new policy, I would say that we don't necessarily see a home for every child as a major shift, in as much as we see it as a moment to bring more and very important clarity to what we're trying to achieve in the collective. I feel like we have a shared vision around this concept and what's going on already. We have purpose, we have concrete actionable goals, with the idea that children are cared for in a safe and loving home. I think what stands out most is the emphasis on the kid first strategies. Prioritizing kin expands the available homes while keeping children connected to their families or to the communities or the networks within which they're already accustomed and comfortable. So prevention and access to supports like kinship navigator programs, legal assistance, are truly going to be essential to making this work as well. It's no surprise, and as research tells us, children do better when they remain connected to people they know and trust, whatever that may look like in their orbit or in their reality. So this isn't just about finding homes. It's about recognizing families and networks that already exist and making sure our systems support those connections rather than disrupting them. So to us, this moment really offers alignment across prevention, kinship, permanency, and data around that goal of safe and loving care for our nation's best assets, our children.
Thank you so much, and I wholeheartedly agree. And now I'd like to turn it over to Rita to tell us a little bit about herself and her organization and general reaction.
Great, thank you. And thank you to APHSA and Northwoods for convening this important gathering. And I'm just delighted to be here with Kristen and Mike, whose leadership you all know continues to drive meaningful progress for children and families. I'm Rita Sornin, President and CEO of the Dave Thomas Foundation for Adoption, a national nonprofit public charity, honestly with a singular mission: to advance permanency for children and youth who have been waiting the longest in North America's foster care systems. I've had the privilege of leading the foundation in the United States and Canada for nearly 25 years. Prior to that, I managed the court-appointed special advocate program here in Central Ohio. And prior to that, I was involved in statewide prevention work. So it's been a bit of the full circle process for me in the child welfare system. Our work at the foundation, though, includes several signature efforts, most notably our evidence-based child-focused permanency program, Wendy's Wonderful Kids. Through public-private partnerships, this program is currently scaled or scaling in 19 states and one Canadian province, and has helped to facilitate more than 16,200 permanent placements of youth who, prior to the program, were simply on that path of aging out of care. And by permanency, of course, we mean all forms: adoption, legal guardianship, reunification, or reinstatement of parental rights. So my reaction to the new policies is very similar to what Kristen and Mike have already talked about. We're deeply encouraged by the sense of urgency and a commitment behind a home for every child, and particularly its focus on aligning policy and practice and data to better serve children and youth in foster care. I would add, though, at the same time, we would underscore that a foster home for every child must also have a parallel goal of a permanent home for every child, and ideally one that's rooted in the child's kin, culture, and community. Achieving this vision requires a sustained focus on sustainability and support for children and the families who care for them. And this includes addressing trauma and mental health needs, expanding capacity and services for high acuity children, accommodating sibling groups, and ensuring caregivers have the resources they need to succeed and sustain in this work. So it's our hope that a home for every child continues to elevate both resources and accountability, and driving that broader shift toward aligning policy data and frontline practices so that we can reduce delays, support evidence-based practices, and frankly, ultimately, move toward measurable long-term well-being outcomes for children and families.
Thank you so much, Rita. Very well said. You highlighted a lot of the key points. I like that you're deeply encouraged by the sense of urgency. That's great to hear. Okay, I'll turn it over to Mark to tell us a little bit about yourself, Mark, and your organization and your reaction.
Yeah. So my name is Mark Ruff. I lead product management here at Northwoods, particularly in the innovative technology solutions. So what we do is we build a bunch of different solutions for social services agencies, particularly in the child welfare space. So I've been working in the health and human services sector for, a few years now. But yeah, I can't really speak from, necessarily like a policy or a boots on the ground perspective, but I can speak from a technology perspective and like a data perspective on the new policy. And personally, I think that this introduces a really good step in the right direction towards some major innovation, particularly from just how we're measuring performance of agencies and how agencies get to think about how they measure themselves. In any industry, I think after a while, when you're looking at the same metrics over and over and measuring yourself against the same metrics, you kind of lose sight of which metrics are important. And you kind of lose sight of if those metrics are moving you to your ultimate goal at the end of the day. And so just an example that I love that kind of paints the picture of what I'm trying to communicate is, back in the early 2000s, there were a bunch of different social media companies that were trying to be the top social media company. They were trying to get the most number of users. All of them were measuring themselves on the metric of daily active users. Facebook approached this from a very different perspective, and they said, that's not a metric that measures the quality of what we're trying to get to. that's a very quantitative measure. We want to take a look at what metric can we find that measures the quality of what we're delivering. And so they looked at the metric of engagement. Can we make our platform more engaging? The number of people liking our posts and the likelihood of someone sharing our posts. And so I think kind of what to Mike said earlier about like when you wake up day to day and think about what it is that you're going to do and you think about the metrics that you're trying to hit, having metrics that more reflect the quality of what you're trying to do, I think helps drive that day-to-day decision making and ultimately leads to better outcomes. And so I think that ultimately this policy is just a good reset for agencies to start thinking about how can we better measure ourselves and how can we help that drive our day-to-day. So yeah.
Great. Thank you, Mark. And I love the social media reference. And yeah, I definitely feel like having this ratio, the numerator and denominator is a clear focal point. Also, everyone needs to keep in mind all the other multifaceted pieces that go along with just counting homes, but everything along with prevention and permanency and kinship that's been mentioned already. But I do think it's very clarifying to have a new metric and, numbers to look at with that ratio. All right, great. I want to thank the panelists for sharing about their organizations and their reaction. And at this point, I'm going to shift the conversation a little bit more into a policy discussion. And I have a round of questions again to start with Mike. So the first question for Mike is about your work at Think of Us, which centers around voices of lived experience. And in the context of a home for every child, what are you hearing from that community that you think policymakers or decision makers need to better understand?
Yeah, so a few things, and timing is great. I had 3 virtual roundtables with about 25 young people last week, and got to hear some really good and some really not so good things, right? And so what I just want to start with, families are still being asked to fail before they get help. Okay. And so there's 3 patterns that I think are coming through what we're hearing. First, access is too slow and fragmented for families to get the appropriate support, whether that's behavioral health, housing, concrete supports, not getting that early enough. And then the help often comes after crisis. Okay. So not before. So in the as far as a home for every child, right? Like, yes, we talk about prevention, but we have to figure out how to align accountability and cross system responsibility to where everybody feels like they're owning this the help for the families that are really in need and are coming to the attention of the system. A lot of these systems encourage that's not okay, right? They need to be thinking about alternative supports and ways to help families. Second, I don't want to get too much of this because I think Kristen will probably should address more of this, but just kin, right? Stepping up. But the system slows them down. So the families are there, but our processes, licensing, and delays get in the way. And I think, there's been a lot of great work over the last few years, but it's still there. So that still exists when you hear kin talk about that. And then third, young people, they continue to experience disconnection, right? Especially when transitioning out of care, and stability in relationships are not consistent. How do we get to that healing and that belonging and that connection? How do we continue to push for that as the outcome, right? And the goal instead of independent living. And again, not too long ago, I mean, I've been in this work a couple decades, but when I was young and inexperienced, people were going, "Hey, it's independent living, or permanency." Or was a big word. And then luckily I had great leadership that taught me and others that it's right? We are focused on permanency. We need to make sure there's connections and we build those strengths and the connected, caring adult. And independent living is part of that, but we have to have that piece of it. But we still know that's not consistent. I think the policy direction has a focus. It creates energy. It creates the things that we need to put our focus on. And that's what I did when I was running systems, right? How do I reduce entry into care? prevention, right? How do I keep children with their family of origin? How do I get timely permanency? And then how do I, if I'm doing that with quality, then I'm reducing hopefully re-entry into the system, right? Or no re-entry into the system. Pre-adoption, post-adoption supports, much needed, right? So I just want to end with, families don't experience policy, right? They experience whether help shows up when they need it. And also I'm a big, workforce guy, right? And I think that as our workforce is trying to do the right thing inside these systems that are complex and fragmented, that often make the right decisions harder than the safe decisions, we have to figure out on the ground what their job is to create that impact and not add more. This shouldn't be about adding more to their plate. This is about making sure we understand what works and how to get to those outcomes more quickly. So, if families have to navigate 5 systems to get help, we haven't solved the problem. We've just moved it. So I'll end there.
Well said, Mike. Thank you. And I love your point about the workforce and that families don't experience policy. They experience the programs and the people that are working with them one-on-one in their community. And so that's great to keep in mind. Thank you. My next question is for Kristen. I'm sorry. Your advocacy, Kristen, centers around grandfamilies, multi-generations, and kinship care. From a policy perspective, why is it important for counties and states to intentionally engage the broader kin network for a child? And how does that approach help put a home for every child into practice?
Great, thank you. And I'll give an amen to everything that Mike has said. So you might hear a little bit of some of the themes that we have. It's like we're all friends and plan this together. From our perspective, and this is not going to come as a surprise to anyone that I'm saying this, it's imperative that we engage as early as possible the broader network of grandparents, extended family, close family, friends, and other people that know that child, who know, keeping that main thing the main thing. And so they all need to be a part of consistent support system. And this is what helps make a home for every child real. There's a lot of work to be done to get us from here to there, of course. But we would continue to argue that kinship must be the first conversation, not the last resort. We're not just searching for placement. We're searching for these lifelong connections, which is what Mike was talking about, and these lifelong networks of support so that child in the center of all of this work has the ability to live a successful and thriving life. And while seeking that kinship home for placement, we need to concurrently search for connections that can provide respite for that caregiver. That can be a mentor and a role model for the child that gives them the space to do that, or simply just to be able to attend one of their baseball games without worrying about everything else that they have to worry about for that child. Because a home isn't just a place. It's really a belonging, a safety, an identity and continuity in a community. And when it's well done, it leads to greater stability and stronger permanency outcomes. So that's kind of our perspective on this. It's engaging from the beginning in that process. It goes back to everything that I've tried to live for in my career, in my personal life, is understanding, hearing the boots on the ground, hearing what the families that are impacted by this are really experiencing as we create the policies, practice, and procedures to really put this in place, and obviously supporting the workforce that really does the hard work alongside those families.
Thank you, Kristen. I love that. And I love that, to emphasize and underscore the home is not simply a place. It's the identity and everything else that you mentioned, which I think is very key in this conversation. My next question is for Rita. At the Dave Thomas Foundation for Adoption, you're deeply focused on achieving permanency for children through adoption. From a policy perspective, how can states and counties more actively use data and evidence to drive decisions that shorten time to permanency, improve outcomes, and hold systems accountable for their progress?
Yeah, thank you. And it's such a great question, and one that we continue to work on as we work with states and seek to understand the data that's there and how do we effectively use it to make sure that children can be everywhere they need to be, Kristen, in their families, and Mike, exactly what you two have been talking about. One example is in thinking about where children are in their journey toward permanency for us before they land on, for example, a Wendy's Wonderful Kids caseload. And that data is there. So child-focused recruitment, the model behind Wendy's Wonderful Kids, focuses on those youth who are at risk of languishing or getting stuck in care. So older youth, children in sibling groups, children with special needs, children who've been in care for so long that they resist efforts at permanency for all the reasons that we all know, right? They have no reason to trust adults. They don't want to leave their family of origin. They don't want to move again. They don't want to be reabused, whatever the situation is. And so they resist efforts at permanency. But by offering tailored evidence-based services, we work to reopen those paths to permanency for those who might be at risk of losing that momentum toward permanency in the system. But of course, there are limited resources available to scale an intervention like this. So we look to existing data to answer the question, are we identifying the right populations of children who could benefit from this service? And again, these are children who've already been separated from their family of origin. They're in the system, and it's our job to move them to permanency. So we worked with Chapin Hall to identify youth in states who were least likely to leave care based on certain characteristics. For example, length of time already in care, current placement and placement changes, race and ethnicity, age, and community level adoption rates, looking at all of those factors, again, that we have information on, but we may not be using effectively. And we approached it in two steps. In analyzing the data, first we asked, who is most likely to lose progress toward permanency? And when in the child welfare journey does this loss of momentum happen? And second, we asked, where in the system does the adoption process tend to slow down? So answering both of these questions helps to ensure that at a policy and a practice level, we can ensure services and reach the right youth in the right places at the right time, ultimately improving results and making much better use of resources.
Thank you, Rita. That's fascinating to think about the journey in the different pieces and parts, the steps, and where along the process do things slow down and how to address that. And to break it down like that, I think is really important. Okay, my next question is for Mark. And I see that we have some questions coming in the Q&A. And Mark, there was already a question that I think you're about to address. So we're hearing about the importance of the right match to support a child's sense of belonging and connection. And Mark, you focus on innovation and technology at Northwoods. So my question is, how does technology help states and counties implement both prevention and permanency with these kind of policies?
Yeah, definitely. Great question. So I think the way that we look at technology and social services is really going to change over the next few years. I think that in this industry in particular, when we talk about technology, it's kind of always been somewhat of a bad word. I think when you go to any agency around the country and you talk about this new technology that you're introducing, everyone's immediate reaction is, okay, great. Here's another place that I have to go to log data. This isn't something that's necessarily going to help me. This is just another area that I have to go and I have to put information into for whatever reason. And so I think that has the opportunity to change a lot with this new policy, particularly around the way that we capture the data and the way that we measure the data and why we're measuring the data. Particularly with AI technology today, we have capabilities that we never really had before. We have the capability to analyze data in a way that we never have and to capture data in a way that we never have. The whole point about collecting data is that, we have all these different data points. We grab these different data points, we kind of extrapolate from them and create insights and information that help us understand our cases a little bit better, help us understand our clients a little bit better, so that we can take the proper action and make the proper decisions that lead to the best outcomes. So I think that agencies are sitting on a lot of really interesting data. Um, it's mostly, however, this like unstructured data. It's case notes, it's documents, it's things that are written in like plain English. And the cool thing with technology today is that, they're built on these things called large language models that you may have heard of. And the cool thing about those is that like that gives us an opportunity to look at all of this data that we have and really analyze that and look for like a lot more qualitative insights about that information that we didn't really have the time or capacity to look into before. You can pull insights that we never really have been able to before, like does the child speak positively about this person, or have case notes improved in theme since this last placement. But like it really gives us an opportunity to digest the data in a way and grab insights and information in ways that we never have before, so that we can really understand our cases, we can really understand children, and hopefully lead to better placements and better insights. But also in regards to like capturing the data, it kind of works the same way. Um, Technology has always been, it's a screen I go to where I have a form that I have to fill out and log all of this information. But having LLMs give us the ability to just speak to them. Let me talk about my case. Let me talk about my child. Let me talk about this visit, this new placement. We can capture that data and then log it and store it away so that it can be retrieved a lot better. Like it's a much better way for us to be capturing the data that we need to capture and measuring the new things that we want to measure. So I'm really excited. I think there's going to be a ton of change in the next few years, and I think we should really be thinking about how we can use technology to work for us rather than the other way around.
Love that, Mark. Yeah, I totally agree. Thank you. And I really appreciate your perspective being the tech person here. Okay, so now I'm going to shift the conversation a little bit more towards putting policy into practice. And I have another round of questions, and also looking at the Q&A again that from viewers. I know there's a question about permanency, and that'll be addressed coming up shortly. Or I'm sorry, about prevention and kids who are not system involved. So we will be talking about that. So this next question is for Mike. As states strive to improve access to safe, stable, well-matched homes for children, what systemic or operational changes are needed at the state and county levels, in your opinion?
Yeah, I mean, well, there's a lot. There's a lot. But again, we're I think every state or jurisdiction or county is in a sort of different developmental state within the system, right? We have 25 plus states who are in some sort of lawsuit, settlement agreement, consent decree in this work. And so what that tells me is that we have a long way to go. And we have a lot of needs, both resource wise and process wise, to figure out how to continue to improve the quality of this work. We also have to remember that we are dealing with humans, whether that's our workforce and or the folks we're working with, and that compassion and care has to be shown to both those populations. Um, as far as moving from policy to practice, right? Like I always focused on, preventing unnecessary entries. So on that front end of the system, what does it take to make those policy shifts, practice shifts, so that we're putting more resources and supports towards families, right? What are the clear pathways that are outside the system and easier, fastest access to those supports? I think if we continue to do that better and more of that, that's a great thing for families. Uh, so we have to really focus on that. The other thing is move to permanency faster, right? We have to get alignment with all the systems that have a stake in that, right? So it's court, it could be CASAs, guardian ad litems, foster care review boards, the agency itself or the jurisdiction, right? Like we have to be, tracking bed days and looking at making sure that you're looking at, if it's a teen, right? Are we getting to, and they're headed that adoption track? What's the barrier for that? Where's kin? Is reunification still something that we need to be working on, or and the main thing urgently on the front end? Um, you know, a lot of times that stuff as systems are overwhelmed, that stuff drags on. And you have to look at where those points of being overwhelmed are so that you can fix that, which will ultimately drive to permanency faster. So you need to work on all of those things. And then supporting the workforce to deliver both of those. We don't do enough of that. And so we have to continue to put into our workforce, the appropriate coaching, the appropriate training, the supports needed, the ability to access the resources for families. And then again, all of the visits and all the things they have to do, what really is impactful? What really makes a difference? And then the documentation around the technology. How can we just make it so much easier for them? And there's so many tools these days that we can leverage that. But I want to say that we got to focus on that front door. We all heard that. We don't have accountability for prevention. We have accountability after failure, right? So we hold the system accountable for that failure, but there's no accountability for all the stuff that needs to happen to wrap around families on the front end. And then I talk a lot about cross-system responsibility. Child welfare can't do this alone, right? All those other systems have to understand their part in this, and there has to be some accountability for that. So as we're looking for, improving, a home for every, we're rolling out a home for every child and all the aspects of that. The other organizations in your state or county and at the federal level have to be brought in to understand what child welfare is, and how impactful negatively it can be and traumatic for families. And so that's why we really count on you to have to do those things, right? That has to change within that. A simple example to get better, more faster permanency, we got to look at ICPC, the Interstate Compact. A lot of my young people who were in the system for long periods of time were in an ICPC case. And we have to figure out how to, across states, do that work better, and support each other so that we can move cases along. Because I'm sure that I had cases in other states. I know that there's states who had cases in my state, and we were the barrier to that. So, those are things that you just got to look at. And then workforce redesign. Let's clarify our priorities. This gets at what are the execution for a home for every child at the frontline staff. Clarify your priorities, simplify processes, and then make the workload manageable. And that can happen. You can do that when you have a plan in place to do it. So I'll stop there.
Thank you, Mike. A lot of great insights, and you're right. You don't want to let the system drag on, but bureaucracy and things. There are a lot of points in the process that can be looked at in terms of how to expedite and how to bring other systems together to get things moving. In my prior career in juvenile justice, I was involved with Interstate Compact, and I know that's a lot of regulations, a lot of dotted I's and T's to cross and things like that we don't want to slow things down when we're thinking about permanency.
Yeah.
Okay, that flows right into the next question, which is for Kristen about prevention, talking about the front door here. I know prevention is another core pillar of a home for every child. So Kristen, how should states and counties think about supporting children and families who are not involved in the child welfare system? And what actionable steps can help prevent the need for system involvement in the first place?
Thank you for that question. I really appreciate the fact that, in our view, prevention starts with one simple truth, and that is most families step up long before systems do. And I know I've said that before, but I'll continue to reiterate it. So it really is important to acknowledge the kin caregivers as experts in their own families. So we have to give those caregivers that active involvement in decision making and the system development as well, what works for them. A lot of the things Mike has touched upon. And at Generations United, we've worked with kin families, both inside and outside of child welfare system for 30 years. And what we consistently hear, especially from the caregivers in our Grand Voices network of advocates, is this. People are already doing the right thing, but often without the legal authority, financial support, or coordinated services. And outside of formal systems, families, as we've all kind of alluded to, have to navigate these fragmented supports alone, in addition to everything else that's going on in their reality. So if we are serious about prevention, we have to support the families already keeping children out of foster care. So that means making support easier to access, better coordination across systems, which is a clear theme here. Because when those systems are aligned, the well-being outcomes come. They're achieved at a lower public cost and with better long-term results. And so, again, keeping that main thing the main thing means taking away those barriers. But more broadly, this is about designing systems that reflect how families actually function, not how we think they should have to function to get to the end game. Because prevention isn't about creating something new. It's about strengthening things that many families are already doing every day. Millions of children are already being raised by relatives, family, friends. If even at a fraction entered into foster care, the system would be overwhelmed. So kinship families are not just a small part of the solution, but they are the backbone of the solution. And we'll stand by that all day long. So these conversations about how we all break the barriers for all of these things today is a significant one that can't just be made at the national level. You have to weigh in at the local and state levels as well.
Thank you, Kristen. And I love that you're pulling out the common themes already about cross-system collaboration and, of course, families first and kinship, which I do hear coming up over and over, as well they should. My next question is for Rita. Building on the earlier discussion about the importance of finding the right family, the right match, what specific practices have you seen that lead to better, more durable matches, and what should leaders prioritize implementing now?
Thank you. A great question. And I want to thank Kristen, of course. We'd love to not be in business, actually, because we don't need to deal with the kind of permanency efforts that we're doing. But since we do, there are a number of key practices, I think, within this child-focused recruitment model that we know lead to better matches and outcomes. First, there need to be dedicated, highly trained and supported permanency professionals that are committed to the longest waiting children, that believe these children can move to permanency. They need to carry smaller caseloads that are focused exclusively on permanency so that there's time for both developing a consistent and trusting relationship with a child, but also doing the kind of relationship building, case file and diligent search forensics, and permanency preparation that will lead not only to the identification of kin or fictive kin placements, but families that will sustain and thrive. But I have to say that during that time, it's also critically important that post-permanency services are part of the conversation. Adoption does not stop with a judge's gavel. Families must be equipped, whether they're kin placement families, reunification families, adoptive families. Families have to be equipped with access to resources and services to continue to address the trauma, the grief, the loss, the physical or mental health needs that surround children and youth. Post-permanency has to be a default in the system, not just some talked about safety net. And we know these tactics work. Child Trends did a survey of 129 youth, ages 18 to 21, who had worked with a Wendy's Wonderful Kids recruiter and then were adopted from care at the age of 8 or older. What we found is none of those adoptions dissolved. And on many metrics, the young people who participated in the study are faring as well as their peers in the general population. It's a small study, but it gives us a snapshot that your question, thank you, Amy, when you do work to find kin, when you work to find the best possible matches, when you dedicate the time and resources, and you have a commitment and a passion for assuring children have permanency, then we can show good outcomes.
Thank you, Rita. I appreciate that. And it's good to hear about some evidence and some studies and what they're showing to help lead the way. The next question is for Mark. As states and counties are increasingly relying on data-driven tools, how does information such as family connections and relationships inform better decision-making? And to make it more concrete, can you give us an example about family mapping and how that can be put into practice?
Yeah, definitely. So yeah, just like to share an example of something that that we've done. We were looking at breaking down some of these barriers when it came to like kinship placement, and finding like a permanent placement for children. And we talked to a lot of different agencies, and unfortunately, we heard a lot of the same stories over and over again. We heard stories about children who had been in and out of foster care pretty much their entire lives. Um, Throughout their entire time in foster care, it turned out that there was one mention of a family member, a long lost aunt, cousin, a family friend, or someone who was mentioned somewhere in the case file that was hidden just deep within that stack of paper. And unfortunately, just like that person was never found. And so we saw that as like a huge barrier. Like there's this information that exists hidden within that case file that just never comes to light. And so we said, is there a way that we can create something that helps bring that information up to the caseworker and makes it apparent? And so that's a tool that we've actually built recently, where kind of going back to like finding that hidden data. We can scan through a case file and we can find any references to names within that case file. We can find what that relationship to the child is. We can find whether it's a positive or negative relationship. We can find any contact information that is referenced to that person. And so we can bubble that information up, and make it really apparent and just break down that barrier of access to information and having to comb through information, just to try to improve and increase the ways that we find better placements for children. So I think that's really cool. And it's just a good example of how you can use data that you already have that you may not know that you have. So
Thank you, Mark. And is it a visual in terms of what, do you pull lists of family, or is it more visual, or?
yes, we bubble that information up and we give the caseworker the ability actually to add that information for that person to a visual map. And that visual map is kind of cool because then it can follow that child throughout their entire life. As they grow their network of relationships, you can keep adding to it and it follows them through their life so that, wherever they go, they have that support system behind them.
Cool. Thank you. Okay, at this point, I'm going to turn the conversation to a bit of a lightning round at the end and ask the panelists to wrap up in maybe a couple minutes each to talk about some of the key takeaways from the webinar so far. Some common themes have definitely emerged, and to get into what advice they have for states and counties moving forward. And I'll start with Mike again.
Thanks, Amy. I do think obviously more states are going to join sooner than later, a home for every child. And if I was still running a state, I would as well. And I think it brings energy, ongoing urgency. It shows the other systems that they have a responsibility to be part of this work. And as far as again, the accountability and support in doing the work. We can't be alone in this. And sometimes you feel like you are, and you're the only one who's held accountable for the things that are going on. I think the data piece is a great, as we further, think through the future of the technology we use, not just to reduce burden for staff, but how we use the outcomes. I think we got to stop looking at how we measure too much activity and not enough of the outcomes. We don't measure the right outcomes. And so those discussions will have to keep happening at the federal and state level to figure out what that really looks like, not just some of the core metrics that already do exist. And bottom line, we don't have a knowledge problem. We know it works. We're all talking about it. And in every webinar or symposium or, the same themes come up. The question is whether we are willing to more quickly organize our systems and support the workforce to actually deliver it and support the families ahead of the system, right? We know those things. It's a matter of, can we all just say, let's do that and get away from some of the old things we've been doing since the 90s, or the early 2000s when, we thought it was a good idea and we're stuck to it. We're not stuck to it. Let's move. And that's what I see ACF doing, is saying, if it's not working, we're going to do something different. And we'll figure it out with you all at the table, with young people at the table, with lived experience, and let's build something better. So that's what I hope we start moving that direction.
I agree with you, Mike, and I do think there's great momentum right now and that people are being brought to the table. And I like to see the ACF with this policy. It's a opportunity for change and a time for change. Okay, I want to turn it over to Kristen next to give some key takeaways and advice for states and counties moving forward.
Sure, and I think it'll be at no surprise that I agree with everything that's already been said. And change is always hard, but it's nice to have change agents on this call, as well as the panelists and conveners. I guess we would say consider the 7 steps to a kin first agency and lead with step 1. A kin first approach doesn't hold unless leaders clearly and consistently set the expectation. I think that's through a lot of the conversations that Mike is alluding to are necessary and critical to that. So, from our perspective, the Administration for Children and Families under Assistant Secretary Adams is modeling that right now. And it's kind of our duty to also do it both internally, wherever we may be in the system, and with our partners. I would say along with that, it's just not a one-time message. This isn't one like big splash out there and we're done. I mean, the work's just beginning, from the education about what this initiative really is, how people are involved, what it looks like for them down in the boots on the ground. So it has to be communicated clearly, regularly. It has to be reinforced in all the decisions being made and reflected. And I think this is pertinent to a lot of the folks on this call, and how the work actually gets done. Because when leadership is clear, then the systems start to follow. If it's not clear, we're going to still be in the 90s, doing the same thing over and over. So lastly, I'll say, when we center on that connection, whatever the connection is, systems, people, families, we don't just find homes, but we build that lasting stability. And I think all of the outcomes that we're looking for should drive to that end.
Thank you, Kristen. Very well said. I appreciate that. And I'll turn it over to Rita now for some key takeaways, advice for states and counties.
Sure. And I just want to thank Mike and Kristen and Mark and Amy, you two again. I mean, it's as if we had a conversation before and we said, okay, you say this, and I'll say this. We're also completely aligned, I think. And what it speaks to is this policy effort now is at the right time in the right place. The heightened awareness, the engagement of states, and the urgency with which it's moving is critical. So again, from the Dave Thomas Foundation for Adoption perspective, as we focus on the critical tactics of prevention, family preservation, and assuring robust services and supports for those youth who do age out of care, leaders must also be prioritizing, it's an and conversation, legal permanency for those youth in care as an organizational, legal, and moral imperative. Please continue to prioritize and support family-based care. Always move with a sense of urgency. Children are children for a very short period of time, and consider aging out of this system as failure. When we know that we have the evidence-based resources and practices to move children to families, legally thriving families.
Very true. Thank you. Okay, and I'll shift to Mark for your key takeaways and advice moving forward.
Yeah, I guess I'll keep mine pretty short, but just kind of in the same theme of data and metrics. I think that, there's a big opportunity for us to measure a lot more and measure a lot more effectively. So I think just, finding the metrics that accurately reflect the quality of the services that you want to deliver, get creative with that, really try to figure out, what are the metrics that matter to your agency and that really drive the day-to-day decisions that, ultimately lead to that quality. So I think that's a really exciting time to be here and be in technology and, be measuring what we do and creating that big impact. So.
Thank you so much, Mark. I appreciate that. And Rita, I agree with what you said. It's as if we'd all had a conversation. There's a lot of alignment here. a lot of similar themes that are coming out for the key takeaways. And it's wonderful to have this kind of roundtable to hear from all of your experiences collectively and individually to gain perspective on moving forward so that this isn't just a one-time thing. As was said earlier, I think Kristen said that this is a moment in time, but we want it to make a practical difference with workers and communities, working with families, and equip that workforce to do that type of work. At this point, I want to thank the panelists for putting up with these questions. And I want to get into some of the questions from our viewers that are being submitted, which I appreciate. We have some comments, some questions. And before I do that, I will say that if we don't get to your question, we will try to answer it when the recording is sent out by APHSA next week. So look at that email and look for some of the Q&A to be included with that email. I also want to briefly mention that I have an article coming out in the spring edition of the APHSA Policy and Practice magazine that should be published in the near future. So look for that article. It's also on Home for Every Child. You'll also hear from some of these panelists and the same organizations included in that article. Okay, so I will move forward with some of the questions. And let's see, the first one is, what does it mean for a state to be signed on to a Home for Every Child? What are they committing to doing aside from focusing on the core metric? Does someone on the panel want to answer this?
Yeah, I mean, I could jump in on a couple of things, right? So, I think there's a couple components in making sure that you're measuring your homes to children, right? And again, that is something that uh, states and jurisdictions and counties have to really always think about is, making sure they have, the right number of homes, but it's not just the number of homes, it's the right homes for the children, right? A lot of people are like, Mike, why don't we recruit for infants and babies? You don't need to recruit for them. There's a line out the door. I need to recruit for the right large sibling groups and teenagers, right? That for that, hopefully their short period of time in care to have somebody to be there for them. The other thing is looking at some of the benefits and how they're handled, and making sure that they're looking at again the SSI benefits and those kinds of things, right? What is the state ready to put in place to make sure that that the funds are going not just to their placement and care, but to that child. So that's just a couple of things.
Thank you, Mike. Does anyone else want to add to that? If not, I'll just add also that when a state formally, I've seen generally the governor is signing an executive order or proclamation to declare that their state is signing on, and they get into a performance improvement plan that talks about what they're going to measure and generally reduces and highly focuses the metrics that they're going to look at in child welfare related to permanency, prevention, and it's still happening that kids are sleeping in offices and kids are waiting on homes and placements, and the whole point is to reverse that and move kids towards permanency and involve kinship and everything else that's been shared today. I'll get to the next question. We'd love to hear thoughts about the use of AI to bridge things like administrative gaps, for example, within systems supporting foster care youth. Thank you in advance. So Mark, do you want to comment on that?
Sure. Yeah, I can comment on that. So I think when talking about how systems work together, just in regards to tech, a big barrier in the past has always been agreeing on which data to share and how data is going to be shared, and API access, and matching up tables and databases and things like that. And that's always been a huge roadblock for just the sharing of information in general. And so I think the interesting thing with AI technology, kind of what I said earlier, is using AI technology to understand the unstructured information. Systems are sharing information a lot with each other. It just exists in an unstructured way. Usually it's, signing a release of information and getting a piece of paper, like getting a document with the information that you need on it. And so that information is there. It's not necessarily like sharing tables in a database and sharing data in a database. It's more, sharing that documentation that we can use AI technology to then take that information and get the insights and the info and turn that unstructured information into the structured information that we need to use to analyze and make decisions. So I hope that answers the question.
Perfect, great. And we're just about at time. So at this point, I want to again thank our panelists. All four of you have been phenomenal. Thank you for taking the time today to share your insights and perspectives. I want to thank APHSA again for your partnership. And lastly, thank the viewers for spending the hour with us today. And that concludes our webinar.